in an hour. Today I have the honor of facilitating the What is the Data Telling Us Evaluations and Study session. We have 4 panelists. Two of them you've already heard from, so this is going to give you an opportunity to do a deeper dive in those particular experiences because they've done some more in-depth evaluation. The first is, let me just do some short introductions. Danielle Bergen, who you have met before, she's a social science research analyst for the SNAP Research and Analysis Division of the Food and Nutrition Service, and she's currently the project officer on USDA's Healthy Incentives Pilot Program. Then second, we'll hear from Ricardo Millet. Did I pronounce your last name? Millet?
Yes.
Okay,
Millet.
thank you. Good. Is the principal associate at Community Science. He's the project leader for the SNAP cluster evaluation, which has been a combined effort with Wholesome Wave, Fair Food Network, the Market Umbrella, and Roots of Change. And then Karen Kinney is the executive director of Washington State Farmers Market Association, which represents 112 farmers markets in that state. And she piloted Washington's first cell phone-based farmers market SNAP EBT program. You just were hearing from her a few minutes ago. And then our final panelist will be Christina Booker, who's an associate in the U.S. Health Division at APT Associates in Cambridge, Massachusetts, and she'll give a brief presentation on the New York City Health Bucks Farmers Market Incentive Program. So I will let you take it away. Do you want to come up here? Thank you, Danielle.
Great. Thanks for inviting me again to share more with you all about Healthy Incentives Pilot and talk specifically about the evaluation effort and the impact findings. I will preface this by saying that all of the findings I can share today are still from the interim report, which is available, and I'll give you the web link. The final report is wrapping up and will be available this summer, but I can't speak to any of those results here. So much of this I've already covered, so I'm going to go through it quickly, so I hopefully have time to cover everything else I have in here. But just to refresh your memory, it's a 30% incentive on SNAP purchases of targeted fruits and vegetables. The incentive is received in the form of increased SNAP benefits, so the amount is credited immediately back on their SNAP UT account. So in order to earn the incentive, you have to be a HIP participant, make a purchase of eligible items with your SNAP card at a participating retailer. And I'll also note, because I didn't say it earlier, that it works seamlessly if it's an integrated electronic cash register. So if it's a larger retail chain, those kinds of stores that have that. If it's a smaller independent store without that integrated electronic cash register, people had to self-identify, say I'm a HIP participant, and then they'd have to sort out those items so that they could subtotal them to calculate the incentive and earn that amount. I'm going to skip the rest because we already covered it. All right, there were 5 evaluation objectives for HIP. The primary one is really to estimate the impact of HIP on individual food consumption. Then beyond that, we're interested in determining the various factors that influence how HIP impacts participants, so to be able to understand some of the mediating and moderating effects and considering demographic subgroups and differential impacts, those kinds of things. We also wanted to describe the implementation and operation of HIP, examine the effects of HIP on the grantee and its partners, so that includes on retailers, so there was research done to assess that, and estimate the costs associated with HIP, which also included estimating the cost for expanding it nationwide, so what that would take. The interim report, which is what I can speak to today, addressed the first 2 objectives. The final report will speak to all 5. We collected a lot of data to support this evaluation, and there will be public use data files provided once they're all cleaned and ready to disseminate. We did 3 rounds of participant surveys. There was the first round that happened prior to the implementation of HIP, and that included a fruit and vegetable screener. the subsequent 2 rounds that were conducted 4 to 6 months after implementation and then 9 to 11 months in included a full 24-hour dietary recall. So that gives us a really robust measure of consumption, of the intake among the participants and the control population. Sure, there's just an echo. Let's see, in addition to that, we collected EBT transaction data for all SNAP participants in the county. So we had the transaction data for both the HIP sample and the rest of the non-HIP participants. So that also provided, in addition to the typical transaction totals, it also provided data on the HIP-eligible purchases and the incentives earned. SNAP caseload data provided additional information that we were able to link to the EBT and survey data to support some really rich analyses. There were also 2 rounds of 3 focus groups, and they corresponded to the time frame during which rounds 2 and 3 of the survey were conducted. And finally, to support the process evaluation, multiple interviews were conducted with various stakeholders. And the implementation report, which is available in roughly the same place as the interim report on our webpage, provides a detailed account of how HIP was implemented. So that might provide some additional information of use to many of you that speaks to that. The other thing I'll mention that I don't have on the slide is that DTA, the implementing agency in Massachusetts, also produced a project report that should be released in the near future. They also worked with the, I always forget I think it's community, I'm going to get it wrong, CISA is the acronym, but they worked closely with them in their farmers market efforts and worked with them to produce a farmers market report. So that will be available as well. And in addition, all of the materials produced for the pilot will be available on their webpage. So to speak specifically to the findings, to the impact of HIP that was determined based on the interim data, and so this is based on analysis of the survey data that took place in round 2 that was about 4 to 6 months into the pilot. And at that point, we did see a statistically significant impact of HIP on consumption of those targeted fruits and vegetables. And the impact was about just over 1/5 of a cup, which corresponds to about 25% increase. Let's see, I just want to note that the total amounts here also reflect a fairly conservative measure of intake, because what we were doing was converting what was really a financial incentive at the point of purchase, so it's affecting purchase, and so we know what was eligible for the incentive in the store, to consumption. So the data was analyzed such that the fruits and vegetables included in this measure is restricted to those that would have been eligible to earn the incentive at the store, right? So if they consumed vegetables that were obtained by purchasing vegetable soup, those wouldn't count, right? But if they made a vegetable soup at home because they had bought carrots and celery. So just to give a little context for these numbers in terms of how they dealt with mixed foods. The other thing to note is that approximately 60% of the observed difference was due to a difference in consumption of vegetables, and 40% was due to a difference in consumption of fruit. So it was really nice to see a larger bump in vegetable consumption. In terms of the incentive earnings in response to the pilot, and this again is based on the interim data, so it's looking at EBT data from March to July of 2012. And approximately 2/3 of HIP participants earn the incentive in any given month. This doesn't mean that they earned it ever, it just means that in that month. So people might have earned it in one month, but not in another. HIP households earned an average incentive of $3.64 each month. If you take out all of those households that didn't earn any incentives during that month, the average would obviously go up a little bit, and then that's $5.55. On average, HIP households spent $12.13 per month on targeted fruits and vegetables in participating stores. And again, that goes up, obviously, if you take out those who didn't earn an incentive in that month. In terms of who was more likely to actually earn the incentive relative to those who didn't, those that earned incentives tended to have higher SNAP benefit levels. They tended to have households including children and tended to be female-headed. But I would note at the same time that there were no significant differences in impacts on consumption by any of the major demographic subgroups that were analyzed. And they looked at gender, age, employment status, SNAP benefit size, among others. And there we didn't see any statistically significant differences on impacts on consumption. There were also no consistent impacts on shopping patterns. We did more extensive analyses on this and actually conducted a full spatial analysis that incorporates the geographic location of participants and participating retailers. And that report will be available this summer as well, and that pulls apart a little bit more some of the data about shopping patterns. But unfortunately, I can't really speak to that at the moment. There was a cap that I think I mentioned this morning of $60 a month, and very few households reached that cap in terms of incentive earnings in any month. Let's see. So when we look at the survey data, rather than the actual EBT data, you get higher numbers on reported spending. This in part makes sense because they're reporting on fruits and vegetables overall that they may have purchased with any tender and any retailer. Right, so you'd expect that to be higher. But there we did see consistent with the other impacts. We saw statistically significant differences. The HIP group reported spending just over $7 more each month on fruits and vegetables than the control group. And the majority of HIP participants reported back in the surveys that they felt that fruits and vegetables had become more affordable due to HIP, and 60% agreed that they bought more and a greater variety of fruits and vegetables due to participating in the pilot. As I indicated this morning about the constraints on communication, we do have data that suggests that that was certainly a limiting factor. 4 to 6 months into implementation, when asked in the survey if they had heard of HIP, 40% reported that they had not. So there was still, a good gap there in terms of communicating to participants that they were part of this program, that it was available to them. And similar percentages reported difficulty in understanding how HIP worked, remembering which products were eligible, and even knowing where to shop, in some cases, whether the retailer they were shopping at was participating in the pilot or not. So the final report, which I mentioned is forthcoming, provides a stronger test of HIP's impact on consumption because it pools the data from rounds 2 and round 3. And so in some sense, these results and the other results provided in the interim report should be seen as exploratory because they don't have the full set of data. The final report will also include additional analyses of nutritional outcomes that aligns with the 2010 dietary guidelines. It will include a more robust analysis of participant experiences and their understanding of HIP, and even connecting that to impacts and being able to try to understand that relationship. It will have a more detailed analysis of expenditures and shopping behaviors. It will report the impacts on retailers and other stakeholders, and a full cost analysis of the pilot and the estimates. That's it. Thank you.
Good afternoon. How are you guys doing? All right. I really wish I could stand here and tell you that you're going to learn something new and exciting from my presentation. But perhaps what is exciting about this presentation on the cluster evaluation of Wholesome Way, Fair Food Network, Market Umbrella, and Roosters Change, perhaps what is exciting is that this is the collective voice, not of one incentive program, but of 4 incentive programs that collectively manage 518 farmers markets, that serve approximately 132,000 SNAP customers, that have engaged close to 5,000 farmers and vendors in 24 states in the District of Columbia. So this is a unique gathering of what has been a very dedicated group of food incentive practitioners to come together and have their programs collectively looked at in a cluster evaluation that focus primarily not on attribution and contribution, and try to lift up effective practices that ought to inform the practice of not only the participating members, but the field as a whole. This is a look at how their sites are spread across the United States. It's not a great map. The United States really don't look like this. But it gives us some sense of how the cluster sample is spread throughout the United States. Now, these 4 programs we're committed to providing data that are responsive to the following questions that you can read and see here, and to assigning a lead program staff to work with the cluster evaluation group from community science, and to review our analysis of this data, to come together periodically in what we call meaning-making sessions to make sense of the data, and to put some context around how the data seem to be responding to these four questions. So the following are selected highlights, finding highlights. And as you will see, much of our findings are consistent with what you've heard from individual presentations here today. Over the 2 years of the study, the cluster tripled the number of markets they supported from, in 2010-11, from 177 to, by the time we culminated our data collection efforts, to 518. Markets had typically been accepting EPT funds for at least 3 years before they began accepting incentives. And as you've heard before from others presenting, there seemed to be a preparation or gestation or billing capacity, a period of at least 3 years before a market seems ready to start and implement an incentive program. More than 80% of the markets provided one-to-one incentive match for SNAP benefits, with a maximum of 10 and to the top $20. But even though there were some folks who maxed out the incentive at $10 and some at $20, universally all programs in this cluster agreed that a one-to-one match worked best for customers and vendors. SNAP recipients, by and large, optimized their redemption. As again, you've heard that report earlier today. Our data suggested that there were the redemption rate was about 73% in 2011, and then we learned how to count better in 2012, and learned that it was, as reported earlier, at least 96% a redemption rate. 75% reported that SNAP incentives were a strong factor in their decision to shop at farmers markets. Again, you've heard of that finding earlier today. And continuing with our highlights, SNAP incentives has a positive effect in local economies. Positive effect in farmers and vendors. 65% of the vendors surveyed reported that they sell more produce, make more money, and increase their customer base because of SNAP incentives. Findings that were not as strong